Do you have pain involving multiple joints in your body? Do you have chronic daily pain in your ankles, knees, and back that worsens with activity like hiking? Do your shoulders and neck always feel tight? The truth is that all your symptoms might be interconnected. Think of your body as a bridge. They're all connected. When one joint has an issue, the rest of the body feels the asymmetric distribution of tension and tries to help by compensating. If the fundamental issue is not addressed in time, the compensatory mechanisms start failing eventually, causing more joint pain in those joints. For example, a person with chronic right knee pain can develop pain in left knee, ankles, hips, low back, upper back, neck, then migraines. Chronic pain eventually also leads to poor sleep and constant fatigue, adding to this vicious cycle of pain and suffering. If structural misalignment is the major contributor to pain, addressing them with proper alignment work is crucial to prevent the issue from persisting or worsening over time. Start by working with an experienced physical therapist or body alignment expert to help you build a home exercise program that you can do daily to build your aligned temple of your soul. When your body is properly aligned, it doesn't hurt. Daily alignment exercises will help you do more with people you love. Hi, my name is Dr. I'm a board-certified rheumatologist who practices integrative medicine in Hawaii. I'm also an osteopath. In this video, I will discuss the biggest contributor to body asymmetry and provide helpful tips on how to start your body alignment journey. I often see patients with pain involving multiple joints, ankles, knees, back, neck, and frequent migraines. They always feel tired because pain frequently wakes them up. They try painkillers like Tylenol and ibuprofen first. Eventually, many get steroid injections in the knees and shoulders. Initially, these seem to provide some pain relief, but for many people, the effect doesn't last. Symptoms perpetuate, sleep issues persist, and people feel trapped. Everyone is born with some natural asymmetry in their bodies due to the uneven distribution of our organs. For example, we have our liver on the right side and spleen on the left. However, certain external factors can exacerbate this asymmetry, leading to bigger issues. Your body's primary goal is to keep your eyes level, and to achieve this goal, it compensates throughout your entire body, from your feet to your neck. Here are some factors that can contribute to increased asymmetry, imbalance in your body. First, injury. External factors such as sport-related injuries to your knees or ankles can increase asymmetry. One thing to consider is that many people have one weaker leg due to conditions like asymmetric bow leg form, which predispose them to get injured in the first place. This is a chicken and egg situation. Second, congenital factors. Some people are born with features that put them at risk of developing early osteoarthritis. For example, people with hypermobile joints often excel in sport due to their wider range of motion when they're younger, but given the hypermobility, joints are less stable. Repetitive microtrauma on joints over time can contribute to development of osteoarthritis earlier than others. Some can touch their forearm with their thumb and their pinky goes beyond 90 degrees, or they can extend their elbows or knees beyond 180 degrees. Often, these folks also have flat feet. Apart from hypermobile joints, some folks naturally develop scoliosis at young age and carry their body weight in an asymmetric fashion. Third, lifestyle factors. On top of all these factors we discussed, our lifestyle adds a lot to the imbalance. In modern society, the majority of people work on computers in sitting position. We have a large muscle that spans from lumbar spine, low back, to inner thigh called psoas muscle. When it contracts, it lifts your leg. When we sit for long periods, the psoas muscle stays in shortened position and develop tightness. Muscles operate in pairs to flex and extend our joints like our hips. When functioning optimally, they maintain the balance between tension in the front and back of your body. The psoas and glutes are a pair, and quadriceps and hamstrings are another pair. They are basically yin and yang to each other. When you spend a lot of time sitting at a computer without doing much balancing exercise, the psoas muscle remains shortened and tight, and we lose muscle bulk in our glutes, our butt. The tension in the psoas muscle get too tight compared to the glute and disrupt the normal alignment. The tight psoas muscle also pull on the low back, causing back pain. Also, while sitting at a computer, our shoulders, they roll forward and neck often follows, making the misalignment even worse. So many of us sit hunched over. Not only do we have to deal with the tight psoas muscle pulling on the low back, but now our poor neck has to carry more weight than it's designed to handle. Too much sitting is one of the biggest reasons so many of us have back and neck pain. So what should we do? We have to optimize our lifestyle and put in daily alignment work into our routine. Everybody's body condition is different. For the best results, I recommend working with an experienced physical therapist. The big picture is this. We need to stretch what's too tight and strengthen what's too loose, balancing out front and back side of the muscles and left and right. Here are the main concepts that could apply to most of us who spend a long time on a computer. As I mentioned, muscles operate in pairs to flex and extend joint like our hips. If you work in sitting position primarily, the psoas muscle and hamstring typically get too tight from sitting. As you can see, hamstrings are also flexed in sitting position, causing chronic hamstring tightness. Most commonly, the goal should be stretching these two muscles, psoas and hamstring, and strengthening the relatively weakened muscles, which are glutes and quadriceps, achieving the balance. Using a stand-up desk is a good idea so that your core muscles can get some stretching throughout the day. Balancing between muscles on the left and right side of the body is also important. Many of us cross our legs in asymptomatic fashion. I like to cross my right leg over left primarily. Also, when you drive, most of us only use the right leg to push the pedal. Putting in some work to balance left and right is important to counteract the lifestyle factors. We need strong abs, abdominal muscles to support the entire body. Abdominal muscles on the front and side help your back carry the body weight, and our abs are essential part of body balance. Last but not least, we need upper back exercises that bring the shoulders and neck back into alignment. Start by working with an experienced physical therapist. Build a home alignment program to balance your front and back and left and right. Your program should include core strengthening and balancing exercise for your glutes, legs, abs, shoulders, and back. Some physical therapy companies unfortunately only allow one body part at a time. In that circumstance, you may need to work on a core exercise program first, then go back for shoulder and neck second. In the end, put them together and build a home exercise program and do it daily. When someone gains a significant amount of weight around the waist, it may also alter their center of gravity, further contributing to misalignment. So maintaining a healthy diet and weight is also important. It may be helpful to monitor your progress by taking pictures with grid lines. My teacher, Keith Cunningham, says you cannot improve what you don't measure. Here's a picture of me 3 months apart with daily alignment work for my core and shoulders. Initially, I had significant asymmetry. Right toe facing out, right hip lower than the left, right shoulder turned forward and downward, right hand a lot lower than the left, and my neck deviated to the right quite a bit. 3 months later, it's still not perfect, but you can see that both of my feet are facing forward and hip and shoulder heights are more even than before. If possible, keep measuring your progress and continue fine-tuning your home exercise program with your physical therapist. To give you an idea, here's a home workout program that I personally followed per recommendation of my therapist for my asymmetric body at the time. I recommend building your own program with your physical therapist since everybody's body condition is different. If you're already participating in some form of exercise geared toward aligning your body, such as yoga and Pilates, and not interested in physical therapy, that's okay. Yoga and Pilates are a great form of full body exercises. Just pay close attention to your alignment. It's better to work with an experienced teacher or coach if possible so that they can watch you. I personally started with physical therapy exercises and progressed to yoga. Now I practice yoga 6 to 7 days a week. If you have flat feet, you may also benefit from seeing a podiatrist, as flat feet can contribute to significant misalignment involving the ankle, leading to more upstream effect in other joints. A properly aligned body will protect you from pain, improve your sleep, and enhance your quality of your life. If you work on a computer, consider sitting a sport. Train like an athlete in the sport of sitting to help your body handle the stress imposed by daily sitting. Give your body daily alignment exercises to help him or her perform at your peak potential without pain. They say Rome wasn't built in a day, and your body alignment also needs continued investment throughout your lifetime. It'll be worth it. In the future, I will post some easy-to-follow exercises that you could squeeze into your busy work schedule, so stay tuned if you're interested. I hope you enjoyed this video. Thank you.